Welcome. It's January 5th, 2021. Happy New Year. We haven't been with you in a while, but thought with a lot of the things that are happening in our community, it would be a good time to get together and share some information with you, like it has been over the last, almost year now. The information changes quickly, but we're going to do our best to make sure that we keep you updated. Before we get started, I do want to make a quick comment about Baylor Bramble. We lost Baylor Bramble, passed away after a 5-year battle. He's a 22-year-old, 21-year-old kid that was hurt in a football game over 5 years ago, but really has been an inspiration, not just our community, but really nationally. And so I had made a post that the Bramble family is a great example of everything that is right and honorable in our city. And we did have the opportunity to proclaim January 2nd as Baylor Bramble Day in the city of Murfreesboro, but really wanted to publicly just say that to the Bramble family that you're in our thoughts and our prayers. So I want to welcome a couple of guests have with us tonight. Have LaShann Dixon, who is the interim director for the Rutherford County Health Department. So LaShann, great to have you here.
Thank you for having us.
And also Chris Clark, who is the director of our Rutherford County Emergency Management Association.
Emergency Management Agency.
Emergency Management Agency. And also he wanted to shout out that he is sitting in Rick LaLance's seat tonight. Correct. So wanted to make sure and let everybody know that. LaShann, I want to thank you for being here. I've heard nothing but good things, and looking at what you've done over the last several months with Dana Garrett, our director for many, many years, who passed away, and you've picked up her torch. And that's really, a lot of people don't realize that over the last year, the amount of change that we've had in our community. Our school director, Linda Gilbert, passed away, and so Ralph Ringstaff has stepped in, and we've had so many people throughout this pandemic who've stepped up and who've carried the torch for people who are no longer here. So thank you not only for what you're doing now, but in the circumstances that you've taken over leadership. Thank you for what you're doing.
Well, thank you, Mayor McFarland, and I truly appreciate that the Rutherford County Health Department, our staff, volunteers, and then just the community partners that we have been very grateful to us, and we are just so grateful for the continued partnerships that we have as we look to mitigate the spread of COVID-19 in our county.
Awesome. Well, I do want to comment, Chris and I are not wearing our masks, but our dais here is almost 20 feet long, and so we're more than 6 feet away, and so want to make sure y'all know I still have my buff here, but we're appropriately social distance. Last but not least, I want to thank City TV. Made this comment the other night that throughout the pandemic and really we've had to reinvent ourselves as a government on how we do things, and City TV, from doing a virtual Christmas tree lighting that I never thought that we would have, that I'm sitting in my living room watching a show that looks like it was produced in New York or in LA. I want to thank our staff for what they've done and how they've gone above and beyond to help our school staff, to help our education system, our first responders, really everyone in the city, to keep everyone informed. So my hat's off to y'all. So I've got a few questions to put together that wanted to ask, and these are all questions that we've been getting from our constituents and from people inside our city, our county. The other thing we really want to make sure and say that the one thing that you can be certain of is uncertainty, and that's one of the things I think we've all learned going throughout this pandemic, is whether you look at it from a spiritual side or you look at it really from a work side or education side. I mean, we're not in control. There's a lot of things that happen on a daily basis that you just have to roll with, and the information changes. And I want to thank the state for the hard work that they've put in. I joked with someone the other day that seeing Governor Lee and everything that he's had to go through, that he made the choice. He could have stayed on his farm, or he could have run his business, but everybody's put in places for a reason, and you have to think that he was put as governor for a reason, and he's doing everything he possibly can to make sure that Tennesseans are safe. So with that, the city, we're not involved in the health department, but we're partners, and our first responders, our police department, our fire department, our emergency service providers have all pitched in to be one with our county, and that really goes to what's happened over the last week with the opening of the State Farm facility to be able to administer the vaccination. So here's a few questions that we want to get, and then we can get some comments as we go through. Explain to us what Phase 1A, 1A2, and 75 years older in terms of the vaccination means.
Yes, so as you alluded to, things are changing drastically within the Tennessee Department of Health. So I do have some notes prepared as far as our vaccination phases to ensure that I'm providing the correct information. So our hospital and county health departments began vaccinating the Phase 1A1 populations in mid-December. The phases include those working and volunteering part-time and full-time in hospitals and freestanding emergency departments where they have direct patient exposure or exposure to potentially infectious materials. Our Phase 1A1 also includes those providing home health services to patients, those working with COVID-19 mass testing sites where no other critical and clinical services are offered, and those also providing student health services in K-12 schools, colleges, and universities. Additionally, our first responders with direct public exposure are also included in Phase 1A1. Also, we include in Phase 1A1 are the staff residents of long-term care facilities, including skilled nurse facilities, assisted living facilities, home health for the ages, congregate care centers for individuals receiving services provided by the Department of Intellectual and developmentally disabilities, additionally as residents in groups' homes. So for our 1A2 population, that is all other healthcare workers, and then our funeral directors as well. And of course, 75 years of age is those individuals who are 75 years of age and older. So currently in Rutherford County, we are in Phase 1A1, 1A2, and 75 years of age and older.
Okay. And then today, I think we have it on our screen. I got on and played on the website, but we have a new website that came out today. If you see at the bottom, it's covid19.tn.gov, and we'll flash that or get that out on our public media. But explain that to us, LaShann.
Yes, so we recently just worked alongside with the Tennessee Department of Health to have this website available for anyone who wants to register to kind of see what phase they fall in. One of the major questions that we continue to be asked is, what phase do I fall in? I may not be, in 75, or I may not be in this 1A1 or 1A2. And so this website can be accessed at covid19.tn.gov, and it's going to allow you to actually look and to see what phase that you're in, and it will provide you with some questions. You'll answer that, and then it'll allow you to see what phase that you fall in, then also kind of a timeline. Additionally, if you do go to the Tennessee Department of Health website, we do have a vaccine allocation phases. You can kind of look at the chart to kind of see where you also fall in within those phases, and it kind of has a estimated timeline. Of course, everything is moving. It's a fluid document that we have, but this is the estimated timeline of when you'll be able to be vaccinated here in Rutherford County.
Okay. In Phase 1A1, 1A2, and 75 years older, how do these groups register?
So currently we are utilizing a sign-up genius in order for them to register. We do realize and understand there's not any registrations available currently right now due to the amount of vaccine that we currently have on hand. And so they can go in currently right now and sign up, and they will be put on a waiting list. Once we receive additional vaccine here in Rutherford County, we will then alert them through that system, and then they'll know how to sign up from there and where to come to receive their vaccination.
So why is it important to register and not just to show up?
Yes, so it's very important for people to register because we were allotted a certain amount of vaccine based off of our population that falls into that 1A1, 1A2, and 75 years of age and older. So we are going by appointment based only as we are continuing with our vaccination efforts. And so we do not want to allow for individuals to come in who are not falling within those vaccination phases. Currently, our supplies, of course, are going to be based off of what we receive from the Tennessee Department of Health, and they have based it off of our numbers of individuals that fall within those groups.
Okay. So how many vaccines do y'all have on hand?
So currently we have enough vaccine in order to administer for the rest of this week. We are expecting to receive additional doses next week or at the end of this week in order to open up more appointment slots.
And I drove past a couple of times today the State Farm campus, and State Farm back, I guess, late March, early April shut down, and now seeing how y'all have transformed that into an administration site. How many vaccines have y'all administered so far?
So currently to date, we have administered 2,650 doses of vaccine here in Rutherford County, and expected to administer another 600 doses over the next 2 days.
Chris, do you want to tell how y'all have set up the State Farm site for those who know that site?
So our biggest thing was keeping many people off of Memorial Boulevard and pulling them off of DeJarnett, looking at an easier way, doesn't cause traffic jams, and then also eliminate traffic accidents. So we routed the traffic. You enter and exit off of DeJarnett. They circle around the campus, the backside of the campus, and then come to the front to the 3 bays that we have that we're administering vaccination and testing.
Okay.
We have traffic cones, we have police officers, we have other workers out there that will help them along the way to eventually get there to the site.
Okay. There's questions coming on about how many doses that you have on hand. So I just asked that question a second ago. So we've got enough to get through this week, expecting that we've got more coming next week. So if you're 75 and older, what other ways could you go to register to be able to get on the list?
So currently what we're doing is we're ensuring that if you are 75 years and older, we do understand that there may be some barriers as far as internet access that we're being able to utilize the current system that we have in play. And so we do ask that they can call a hotline. A hotline will be established this week that they can call and go ahead and set up appointments for their vaccinations. Okay.
And what type of vaccines do we have?
So we have Moderna that we are administering currently, and we are looking at this is two shots, 28 days apart, plus or minus four days within that. The shots are given in the muscle of the upper arm, and it's recommended for people ages 18 years of older. Based off of the clinical trials that we've been able to look at, the vaccine is about 94.1% effective.
What happens? Can you take the Moderna, the first dose, and the Pfizer, the second dose, or are they interchangeable?
So they are not interchangeable. If you receive Pfizer for your first dose, we ask that you receive Pfizer for your second dose. We will also be giving reminder cards that will show on there what dose that you've received, and then we're also utilizing a system called Tennis that we will be able to pull up when you come in for your second dose to see what dose that you did receive of what manufacturer, whether it's Pfizer or Moderna. But currently here in Rutherford County, we are using Moderna.
So we don't have to worry about someone if they've taken Pfizer, our staff not knowing, or the health department staff not knowing that they took Pfizer. They're going to be able to know that.
Yes, correct.
Chris, you talked about how the State Farm site is working and where you enter, but what's and Mayor Ketron, I know, worked on getting that lease worked out, which is turned out to be, I think, instrumental, because I don't think the Siegel, not that it was a negative, it was just hard to get in and out from what I understand. I mean, what are you seeing as the positives with that site so far?
So the positive is it's visual. You can see that as you go down Memorial Boulevard. It's a large campus to allow many vehicles to be in line and be able to keep it all on one campus. We also have drive-through bays where the individuals can sit in their cars and receive the vaccination. We have some type of climate control. Our public health has been outside since March. Extreme weather, sun, heat, and then here recently I pulled up on a Monday and it was sleeting and snowing. And so whenever we went to go find a site off from public health, because we would lock down downtown Murfreesboro because of the traffic, we were able to locate Siegel temporarily until we had a firm grip on the lease plan for State Farm.
Yeah.
Siegel, Director Spurlock with Rutherford County Schools, Larry Creasy, the principal of Siegel, with open arms, welcomed us into Siegel. It was a great place. It was a great setup. We practiced out of there for about 2 weeks. Mm-hmm. And we recently transitioned this Saturday to State Farm. Hats off to our public health personnel, our local partners, fire, police, from Murfreesboro, Rutherford County, Smyrna, Laverne. police officers. We work as a team. We communicate on a regular basis. I believe that even on New Year's Day at 4 p.m. we were on Zoom discussing this, what is going to transpire and the items that we may need from each entity to bring this all together. So it's a whole Rutherford County community coming together to make this work.
And I don't think a lot of people realize what it means to be able. You're basically setting up a mobile clinic, and you move that from one location to another location, and you did that in a day. And then coming through today, seeing how that is quartered off, the signage that you have up. So I mean, I know, and we've said this throughout really since March as we started doing these. You train for this, and you're trained, and our teams are trained to be able to handle things like this. But one thing that I think we can say different from picking someone up in an ambulance or a fire that we have, or even a protest that we have, that there's steps you go through, and here you're learning every day maybe a better way to do something. So I had someone who I talked to they were serviced yesterday. They were vaccinated yesterday, and they said that they went through the sign-up process. It took about an hour. They waited in their car for an hour. They drove through the bays there, vaccinated, and then they were done. And they couldn't be more complimentary on how the process went. So that is a good question. Like, I signed up tonight. I went through and clicked where I fell in all the different categories, and so it gave me my phase that I'm in, and then I gave my name and my email address and my phone number. So if you're on a wait list, will you be contacted, or will you be emailed or texted? I mean, how does that work?
So you will be contacted from the Tennessee Department of Health in regards to when you can sign up for your actual vaccine, and then also where that what the location it will be, and then the times.
Okay.
So you will be contacted whether you gave your email address or if you gave your phone number.
Awesome. How about, Chris, I mean, from the emergency management side, I mean, how are our hospitals managing? That's one question we ask most every time that we do these. I mean, how's our infrastructure looking? I know you talk to Stonecrest daily, and you talk to Rutherford County, or excuse me, Rutherford St. Thomas daily. How are we doing? How are we looking?
I reached out to them as early as right before I came in here, and we have a great communication between the hospitals, and we keep track of that daily to make sure that our infrastructure is stable, and that is the result today. We are stable. Our hospitals are full. However, we classify that as stable. We're not popping tents up in the parking lots and things like that. They're busy. And we have great hospital partners with Stonecrest and St. Thomas Rutherford. We have great clinics with like Middle Tennessee Medical Clinic. And we're looking at this as the whole infrastructure of Rutherford County when we talk about medical. Our EMS and fire response is stable. There are busy times of the day, just not with COVID-19. However, our personnel have to take precautions and to make sure that they're protecting themselves, and also deconning the ambulances and the fire trucks with ultraviolet lights. So during this pandemic, there's extra steps that we have to take as first responders, and then also understand how the hospitals are handling the influx of patients. And so we constantly monitor that. You receive a update every morning or evening concerning our hospital status and the numbers of COVID-19 positives, and then how many are recovered, and then some tidbits of things to come.
LaShannon, if you're vaccinated today, how do you get the appointment to be vaccinated in the next 28 days, or for that second dose?
So what we're doing for that second dose is you will receive a reminder card once you get your first vaccination. On that reminder card, it will have what type of vaccine that you received, as well as the date and the time, and then it'll also list your 28 days later that you need to come back to be vaccinated. So currently what we're doing, we're working with the Tennessee Department of Health in order to reach out to those individuals who received the first dose to get them in for their second dose. So we are expecting that by next week this time that someone would have contacted you if you already received that first dose in order to go ahead and get you scheduled for your second dose.
But if you haven't been contacted, we're asking people not to just show up to with their card. They will be contacted.
Yes, they will be contacted. Second dose will be done by appointment as well, just to ensure that we have enough vaccination on site, as well as just enough staff on site to be able to vaccinate as well. And so you will be contacted. You do not have to contact us. Well, you will be contacted. However, if you're not contacted, whether it's your phone number was printed incorrectly or your email was printed incorrectly, we will have a link available on our Rutherford County government or Rutherford County Health Department website, as well as the Rutherford County government's website, that you can go in and register and sign up for your second dose.
Okay. And the people now, I know we started on Monday, 75 and older. Is that correct? Or was it Tuesday?
We started January 1st, but then originally, yes, it started on Mondays, okay, administering those doses to 75 years of age and older.
So, we've had all of us on the political side have gotten, well, why is this person getting it and why is this person, not getting it? So I want to make sure and let everyone know. I mean, I'm sure that there's people who got it that aren't supposed to get it, when we've got people who are working hard trying to get people vaccinated. So, I would ask, follow the guidelines, make your appointment, and now you have to have an appointment to get vaccinated. So if you're younger and you're getting vaccinated, then you're going to be in that phase one of those guidelines, whether you're a first responder or, because we still have first responders who've not gotten vaccinated yet, correct?
Yes, that is correct. And so we do kindly ask the individuals wait to their phase that they are being vaccinated in. If you do go on and you register and you're not in that current phase, we do have someone that's monitoring that from the Tennessee Department of Health, and so you will receive an email stating that you're not in the current phase, and they will remove your appointment from that slot. Additionally, we are working alongside with law enforcement at State Farm and then our staff to ensure that you are on that list. So once you do arrive at our site, you will be asked your name and the information provided that you provided on the actual sign-up genius for you to be able to enter in and be able to receive your vaccination.
I think that's the questions I had. Is there anything that I missed or anything that y'all want to add?
We just appreciate the community and their understanding. This is a tough time, and we appreciate our medical partners, our first responders. Shout out to our nurses in our hospitals that do this day in and day out. Our first responders, they're going out there and have to wear extra equipment to make sure that they're safe. I will tell you that we have had staffing issues whether the individuals were quarantined or whether they've actually got COVID-19. And so staffing becomes an issue, whether it's a fire department, police department, and especially our hospitals. So, as patients go in, we think that, that these nurses are invincible and, they can receive that virus just as well as anybody else. And they're in it every day. And it's very tiring since we've been doing this. I think March 13th was our first positive patient in Rutherford County. And our nurses and our paramedics and our firemen and all the people that are in medical, our clinics, our minute clinics, they've been going solid since March, and we're continuing to push on, but staffing becomes an issue at certain times. So please think about those people. They've really stepped up to the plate during this pandemic. I see it going a little further, and it's my hopes by football season next year we can fill the stands. We can go and associate with the people that we want to associate with, and we look back and say, we went through this pandemic together, and we were able to make it. So, and our thoughts and prayers of the people that have lost their lives over this. It's been a vicious virus, and we want to continue to protect our public as much as we can. And I'm blessed to live in Rutherford County.
Yeah, and that's really one of the things that we, just because you don't wear a uniform or you have a badge, you've got a lot of frontline healthcare workers that are literally on the front line every single day. It could be the people who are in the health department, our nurses, our doctors who still go into work every single day. So I want to thank y'all for coming. I think we've gotten most of the questions answered, but Melody, the technology challenge 75 population is struggling to find any of this information. I think if you go back about 10 minutes, we talked about how that, LaShanna, if you want to touch on that one more time.
Yes, so we will have a hotline that will be set up this week, and so we will provide that information through various channels to ensure that we are getting this information out to our 75 years of age and up plus. Additionally, I do want to also just add in that we kindly ask the individuals that want to be vaccinated are vaccinated in their county. However, we will ensure that anyone who comes to our county is vaccinated. We will not turn them away, but we are allowed it a certain amount of doses based off of our population size here in Rutherford County. So I know that there has been another question that's been brought up, can I be vaccinated in another county? And so we are looking at your county of residence when we're talking about our vaccine doses that we still have available. And so we do want to make sure that we get that before our 75 years of age and older. We are working tirelessly to ensure that we can get this information out to you in a timely manner, but then additionally making sure that you are vaccinated, because we do understand the severity of the vaccination. And we are grateful that everyone had been very receptive to the vaccine, and I echo Chris's statements in saying that we live in a county that has been very grateful to us at the Tennessee Department of Health, and then also here at the Rutherford County Health Department, and just coming together, because I truly believe, alone we can do so little, together we can do so much. And one thing that I truly live by, and it's a statement that I tell my family and friends every single day, is we have 86,400 seconds is found in each and every day. And so we really want to value those moments and cherish these memories, and we know that we can do that if we continue to push forward with hand washing, wearing our mask, but also getting vaccinated, and then we'll be able to hopefully mitigate the spread of COVID-19 and eradicate it as well.
Amen. Hey, and I know someone was on here asking about the 75 and older population. So clearly, if you're watching this on Facebook Live or you're watching it on City TV 3, you're engaged somehow through social media. So here's what I would challenge you to do. If you've got a family member who's 75 and older who does not have access to internet, or they don't really know how to use it, take your phone, take your computer, go and sign them up. Put your email if they don't have an email, and and help those that are 75 and older to be able to get that information and to be able to help them out. So that's one thing I think we can all say is Rutherford Countyans, that we're always good on being able to help one another out. So that may be something that each of us can take upon ourselves to help that older population that may not be as computer literate as some of us are.
Additionally, I do want to note that we are going to be working alongside with our senior centers, churches, and then also employers to ensure that the information is being disseminated out. And so we will, over the next week, be getting information out to them, because we do understand that we have a large population that is still attending church, whether it's virtually or in person. And so we'll make sure that the churches have that information to share out with their seniors as well.
Awesome. All right, folks, we'll keep you updated as more information comes across. But again, thank y'all for the hard work you're doing. Want to thank also all of our elected officials that we're all learning as this process goes along. So I talked with the mayor of Smyrna today, and she was giving me several things to make sure to help with. The mayor's caucus is all working to be able to get information from our individual communities. So thank you to our city council, and again, thank you to City TV for being here at night and getting this pushed out. So we'll keep you updated, and we'll keep up the good work. So thank you so much.